Hello everyone, welcome back to Exam Key Point Dentistry. So today we are going to study an important orthodontic topic, management of crossbite. This topic is very important for BDS exam, viva question, clinical understanding, NEET MDS preparation. And don't worry guys, today we will learn this topic in a very easy English with a diagram and example. So first tell me in the comment, have you ever seen teeth biting from the wrong side? That condition is called crossbite. So let's start. So, crossbite. So, definition of crossbite. So, crossbite is defined as a condition where one or more teeth may be abnormally malposed. That is, the crossbite is defined as a condition where one or more teeth are placed abnormally, either buccally, that is buccally, or lingually or labially, with a reference to the opposing tooth or teeth as compared to the opposing teeth. So simple meaning is upper and the lower teeth are not biting in a normal way. Okay. So in this, so you can see here it is a abnormal tooth relation. So this is abnormal tooth relation, and in crossbite, the lower teeth may come outside. You see this is a lower bite. Normally, what will happen? The upper teeth will be slightly outside the lower teeth. But in crossbite, the lower teeth, this is a lower teeth, may come outside the upper teeth. So, can you now identify why it is called crossbite? Because the normal bite relation become crossed. Now we will see the classification of the crossbite. So crossbite is classified based on location into anterior crossbite. So this affecting the front tooth. So it can be single tooth crossbite or it can be segmental crossbite. So single tooth means only one tooth is involved, like this. It can be either this or it can be either this. And segmental means a group of teeth are involved. Okay. Now we will see the posterior crossbite. So this affecting the back teeth. So this affecting the back teeth. So it may be unilateral, that is a one side only. It can be bilateral, that is a both side. So here you see the left image show the anterior crossbite. The upper front teeth is behind the lower tooth. And the right image show the posterior crossbite. The back teeth are biting incorrectly. Okay. So which crossbite affecting the molars and the premolars? That is a posterior crossbite. Okay. Now, based on nature of crossbite, so now according to the cause, crossbite is divided into skeletal crossbite. So this occurs because of the jaw problem. Example like a small maxilla and the large mandible. So here skeletal bones are responsible. Now the second one is dental crossbite. So here the problem is only the tooth position. See, the jaw are normal. So it is a teeth malocclusion. Third one is the functional crossbite. So this occurred due to the deviation during the jaw closure. So the patients shift the mandible while closing the mouth. So the deviation of the jaw closure is included in the functional crossbite. So if the mandible is very large, is it skeletal or the dental crossbite? The answer is skeletal crossbite. Okay. Now, further type of posterior crossbite. So, the posterior crossbite has two more forms. That is a buccal non-occlusal. Here, so this is a form where the maxillary posterior occlude anteriorly on the buccal aspect of the mandibular posterior. So, here the upper teeth are too much outside. So, this is the upper teeth. It is a too much outside. So, suppose this one is buccal side and this one is lingual side. So, the upper teeth is more too much outside, is more buccally. Okay. It is called the buccal non-occlusal. Now the second one is lingual non-occlusal. So this is a form when the maxillary posterior occlude anteriorly on the lingual aspect of the mandibular posterior. So here the upper teeth are too much inside. That is that this one is buccal and this one is lingually. So the upper teeth are too much inside as compared to the lower. Okay. So this one is lingual non-occlusal. So the first image show the upper tooth is towards the cheek side, that is a buccal non-occlusal, and the second diagram show the upper tooth is towards the lingual side, that is a lingual non-occlusal. So which side is towards the tongue? That is a lingual side. Okay. Now we will see the etiology of the crossbite. So now let's discuss what are the causes of the crossbite. So first cause is the small jaw, that is an abnormal tooth position. Second one is retained deciduous teeth, that is a permanent erupted palatally. Third one is abnormal habit like a thumb sucking and the mouth breathing. Fourth one is congenitally. Examples like cleft palate. Okay. So thumb sucking can change pressure on teeth and produce crossbite. Okay. So which habit commonly cause crossbite? The answer is thumb sucking. Now we will see the treatment for the anterior crossbite. So first one is removal appliance. Okay. So for now we start the treatment. So first removal appliance is the tongue blade. So it is mainly used for the single tooth correction. So you see this is a single tooth we have to correct. So it is a mainly single tooth correction. It is a flat wooden stick which is resembling to an ice cream stick. So you see this is an ice cream, look like an ice cream stick. It is placed inside the mouth, contacting the palatal aspect of the tooth in crossbite and used for 1 to 2 hours for about 2 weeks. Okay. So in image, the child is using the wooden tongue blade behind the upper tooth. This pressure pushes the tooth forward. Very simple and the economical method. So is tongue blade used for multiple teeth correction? The answer is no. It is mainly for the single tooth. Okay. Now the second one is Catlan appliance. So it is another removable appliance. It is an inclined plane which is made on the lower anterior teeth. So this is the inclined plane which is made on the lower anterior teeth. It can be used to treat the maxillary teeth in crossbite. Okay. And it is inclined plane can be made up of the acrylic cast metal 45 angulation which forces the maxillary teeth in crossbite to be more labial position. So when the patient bite, this inclined plane pushes the upper tooth labially. So crossbite can correct it. Okay. So in image you can see this is an inclined plane which is attached to the lower teeth. Upper tooth slide on slope and move forward. So what is an ideal angle of the inclined plane? The answer is 45 degree. Now the another removal appliance is a Z spring. So it is used for 1 to 2 maxillary teeth when enough space is present. So adequate space for the labial movement. So function is it moves the tooth labially. Okay. So in this diagram you see this is a zigzag spring is seen in removable appliance. This is a zigzag spring. That zigzag design produce force on the tooth. So why it is called Z spring? Because this spring shape look like a Z. Okay. So this is a Z. Okay. This is a Z. It look like a Z. So it is called the Z spring. So fixed appliance, now we come under the fixed appliance. So fixed appliance is used when it is excessive crowding and extrusion is required. Okay. So what are the fixed appliance? So first one is lower posterior bite plane. So this is a fixed appliance used to open bite during the cross bite correction, and sometimes GIC is placed on the first molar to raise the bite. So the first image you see this is a locked bite. Second image show the posterior bite plane open the bite. This is a posterior bite plane which is causing the open the bite. And the third image show the incisor move labially and the cross bite is correcting. So here the main idea is open the bite so the tooth can move freely. Okay. Now we will go for the treatment for the posterior crossbite. So first one is crossbite elastic. So crossbite elastic are attached, that is palatally on the maxillary molars and buccally on the mandibular molar. So they help move the teeth into the correct position. Second, now the another method is coffin spring. So it is a removable appliance. It is consists of the omega shaped wire. So this is the omega shaped wire. It is placed in the mid-palatal region. This is the mid-palatal region. So it is placed in there. It brings dentoalveolar expansion and 1 to 2 mm activation per week. Okay. So its function is it producing the dentoalveolar expansion and activation is 1 to 2 mm per week. So in image you can see this is a omega shaped spring which is attached in palate. When activated it expand arch slowly. So is coffin spring removal or the fixed? It is a removal. Now the quad helix. So the quad helix is a spring appliance with a 4 helix. So you see 1, 2, 3, 4. So it is consists of a 4 helix. It is capable of the dentoalveolar expansion of molar as well as premolar. It can bring about the skeletal expansion when used in the longer patient. So these loop increase the flexibility and the expansion. Quad means 4. Okay. So how many helix are present in quad helix? The answer is 4. Now the next treatment for the posterior crossbite is Hyrax appliance and the V-arch. So Hyrax appliance is also known as jack screw. It is used for the rapid maxillary expansion. Indication is bilateral crossbite, deep palatal and the nasal obstruction. So it is a fixed appliance. Now the another one is Wilson and the V-arch. So it is used for the expansion of the arch, mainly used for the cleft palate patient. So it is a cleft palate patient and crossbite can be corrected. So which appliance is used for the rapid maxillary expansion? The answer is Hyrax appliance. So guys, today we learned the definition of crossbite, classification, etiology, anterior crossbite treatment, posterior crossbite treatment and important appliance. So if this video helped you, then like, share with your BDS friend, subscribe to Exam People Dentistry and comment below which orthodontic topic should I upload next. Thank you for the watching.